इसकी बोर्ड की रिपोर्ट। हाँ जी हाँ जी, स्पेलिंग टाइमिंग है, बिल्कुल बिल्कुल, एक बार मैं हैव सीन ऑलरेडी। हाँ हाँ देखा है, लेकिन थोड़ा सा हैंडी रहता है, हाथ में रहता है।
So on behalf of the Mittal School of Business, I am very happy to introduce our very beloved ma'am. Many times we had got the opportunity to sit with ma'am, Dr. Suri ma'am. Presently she is a professor in UBS Chandigarh University. More than 26-year experience in academic and research. The ma'am's major area is operational research, IT, information technology. Besides with the HR, different various HR fields as well. More than 85 research paper till the time ma'am has written, with the 8 book, especially on the research. So the overall ma'am's major area is the research area, knowledge management. I guess that the research interest is the knowledge management. Many places ma'am have contributed in the academic and research aspects. What I remember that the ma'am has done the consultancy project for the ICSSR and the AICE one project and the UGC projects as well. So long the experience in the research and the academic area. Ma'am has also the board of the member on the different esteemed places. So with all this information, with the permission of the ma'am, can we start the viva of the and the presentation of the Ulfat?
Yes.
Thank you. So you can start the Ulfat.
Thank you. Good afternoon, all the respected panel members. I warmly welcome our esteemed external examiner, respected panel members, my supervisor, Dr. Priyanka Chhibber. I am Ulfat Andrabi, a research scholar, Mittal School of Business, Lovely Professional University. Today, I am here to present my PhD final viva presentation on topic Human Resource Development Climate, Organization Commitment and Work-Life Balance, a study of select hospitals of Punjab. So these are the contents which I will deliver in today's presentation. So starting with the introduction part, the first variable of our study is Human Resource Development Climate. Human Resource Development Climate is an integral part of an organization climate. Human resource development climate is the perception that the employees have about their policies, procedures, conditions and practices executed in the working environment. Second variable of our study is organization commitment. Organization commitment, we can say it refers to psychological attachment, or we can say it is an emotional attachment and loyalty of an employee that feel towards their organization. It is also a very important role to determine whether the member will stay in the organization or they are working with an enthusiasm towards an organization. And the third variable of our study is work-life balance. The work-life balance term it helps employees to balance their personal and professional lives. So it also helps employees to encourage their personal and professional lives to maintain their priorities like family, job and health. After that, this is the literature review we have done through our study. These are some research gaps. Our researchers have done many research on human resource development, climate and practices. They also include work-life quality, employee performance and job satisfaction. However, we saw that critical gaps persist particularly in the Punjab's healthcare sector, where comprehensive studies on human resource development climate across full-fledged hospitals are lacking. After that, nevertheless, little work in the form of couple of articles and only few research has been done with respect of state of Punjab dealing briefly with the staff nursing working in the district hospital. And work-life balance among medical professionals and comparative analysis of human resource development climate in public versus private healthcare sector remain unexplored, despite their importance in shaping employee outcome like organization commitment. Though they have been studied separately, both private as well as public sector, but we thought that comparison between public and private sector hospital has gotten little attention. So keeping these all things in mind, our current study has attempted to evaluate the overall work-life balance and organization commitment of employees, both in case of medical and paramedical staff, towards the existing human resource development climate. After that, these are our objectives of study. First objective is to study the effect of human resource development climate on work-life balance in select hospitals of Punjab. Second objective is to study the effect of human resource development climate on organization commitment in select hospitals of Punjab. And third objective is to examine the mediating role of organization commitment and work-life balance in select hospitals of Punjab. Last objective is to study the comparative analysis of select hospitals of Punjab based on public and private ownership. And this is the study, two research model of our study. In first model, we have seen human resource development climate acts as an independent variable, and we have seen the effect of human resource development climate on work-life balance and organizational commitment acts as a mediator between these two variables. In second model, we have seen human resource development climate same acts as independent variable, and dependent variables organization commitment and work-life balance acts as a mediator between human resource development climate and organization commitment. After that, these are our research hypotheses. The first hypothesis, there is a significant effect of human resource development climate on work-life balance. Second hypothesis is there is a significant effect of human resource development climate on organization commitment in select hospitals. Third hypothesis is organization commitment acts as a work-life balance. And fourth hypothesis is work-life balance acts as a mediator between human resource development climate and organization commitment in select hospitals of Punjab. Fifth hypothesis is there is a significant difference between human resource development climate, organization commitment and work-life balance in private and public ownership. After that, this is our research methodology. In our study, exploratory research, descriptive research and conclusive research has been adopted to analyze the three variables, that is human resource development climate, organization commitment and work-life balance. And our research addressed Punjab's healthcare sector. We have included hospitals of Public Health System Corporation, which regulate government hospitals in the state of Punjab, and we have also included National Accreditation Board of Hospitals that regulate private hospitals in the state of Punjab. And we have used research instruments as human resource development climate. We have used adapted scale of TV Ross and Abraham. And for work-life balance, we have used Bradley et al. And Burr et al.'s questionnaire, adapted questionnaire. And for organization commitment, we have used Allen's and Mayer's questionnaire. And we have used stratified proportional sampling technique, and our sample size is total 382. After that, we have seen the classification. We have shown the classification of hospitals. There are two types of hospitals in the state of Punjab. PHSC hospitals, which I already told that which include government hospitals in the state of Punjab, which are 56 in number, and NABH hospitals, which regulate private hospitals in the state of Punjab, which are 55 in number. And PHSC hospitals are divided in three regions of Punjab: Doaba, Majha, and Malwa. In Doaba region, Public Health System Corporation in hospitals include they are 12 in number, in which district are 4 and sub-divisional 8, and total NABH hospital under Doaba region are 16. In Majha region, PHSC hospital total 7 in number, in which district are 3 and sub-divisional 4, and total NABH hospital under Majha region is 15. In Malwa region, PHSC hospital total 37 in number, in which 12 are district and sub-divisional 25, and total number of National Accreditation Board of Hospital under Malwa region are 24. And we have calculated the total population from both sectors, public as well as private sector. That is about 9,951, and now population is known. After that, we have
Ulfa,
yes.
you are saying we have done. तो we क्या डिग्री दो लोगों को मिलनी है? Who is this we?
No, ma'am, actually we both have done.
So in the research,
Yes, ma'am.
this methodology was adopted. In the research, this thing was there. What is we? I have done it, or in the research, this thing has been done.
Okay. Okay.
So take care of your words.
Okay, ma'am.
Right?
Thank you. Thank you so much, ma'am. Sure, ma'am.
Go ahead.
So I have calculated the sample size from the MNS formula. Now the population is known. After that we put after that I put the these values in this MNS formula, and I got a sample size that is equal to 382. After that, this is the calculation of total population and proportional percentage from both the hospitals, private as well as the public. After that, we have applied proportional sampling population wise in both the sectors, and we have taken proportional percentage population taken from the previous table, criteria for population of proportion to total each table. After that, these are some similar studies which have same sample size as in our study. After that, this is the justification of my research work. Why we have taken Punjab as geographical area. As Punjab ranked 15 healthcare performance according to the Healthy State Progress to India report by Niti Aayog in 2009, in the state of Punjab, Jalandhar is known as Asia's biggest medical care hub due to its more than 800 multi-specialty hospitals, nursing homes and clinics. And we saw that Punjab provides good medical services with both government as well as private hospitals. Many people from other states and countries come here for treatment because of the affordable and quality healthcare.
If Niti Aayog report is not updated, 2019 you are showing
Yes, ma'am.
the data.
Ma'am, it is present.
2024 में हमें कितने साल हो गए?
Ma'am, when I started that time 2019 was recent.
उसके बाद अपडेट करना था ना आपको, जब आप थीसिस सबमिट कर रहे थे उस टाइम पे भी जो है
2025 तक का होना चाहिए ना मैम?
हाँ, 24 में तो होना ही चाहिए। 25 में पता नहीं आपने कब सबमिट किया, कौन सी डेट को सबमिट किया? 24 है ना, तो कोई बात नहीं। 24 में जो भी रिपोर्ट आई थी उसको भी रेफरेंस देना चाहिए था कि उन्होंने क्या बताया। और स्टिल आपको ऐसे भी कह सकते थे कि I have started my work in 2019 and the current at the present in 2024, this is the state.
Okay,
both
sure.
things.
I will incorporate. Thank you, ma'am. After that, why we have chosen this hospital?
Ma'am has said you we to remove, but still you're using these.
Sorry.
So try to work on that my research, in my research.
Yes, ma'am. Sorry.
That I am looking at will be confusing. Maybe use in my research.
Okay, ma'am. Thank you. After that, why I have chosen the hospital sector? The hospital sector plays a very important role in ensuring public health and well-being. So healthcare professionals we always see often face high stress environment, like making it essential to study factors influencing their performance and satisfaction. Also, we can see this hospital sector operate in fast-paced, complex settings where employees encounter emotional as well as physical demand. This environment significantly impacts their work-life balance and organization commitment. After effective human resource development practices are very important in healthcare sector, so these can enhance skills, manage stress and foster employee engagement. This makes hospitals in an ideal context to analyze the relationship between the human resource development climate and organization outcomes. If we talk about the strong organization commitment, that is also important in hospital staff, that is linked to better patient care, so they can reduce turnover and high job satisfaction, which are critical in healthcare settings. After that, why I have chosen healthcare professionals. Medical and paramedical staff often face challenges like they have busy schedules, overwork and lack of appreciation for their efforts. So due to the demanding nature of their job, especially for medical and paramedical staff, they are exposed to higher level of stress. And while focus on providing quality care and services to patients, they know their own well-being is often always at risk. To ensure the delivery of high-quality healthcare services, it is equally important to maintain the well-being of medical and paramedical staff. So, and also we are aware of this fact during the COVID-19 pandemic. It has also further highlighted the importance of employee well-being with the context of human resource development climate, especially in the healthcare sector. After this is a data collection step-by-step procedure. The data collection process involved to explain. First of all, I have explained the questionnaire to the HR managers and having both medical and paramedical staff fill it out during their shifts. Most responses were positive, but some hospitals declined our questionnaire due to their busy schedule, and they are not comfortable for their sharing their information. Data was collected on spot, approximately taking 15 to 20 minutes, with some brief discussions were needed. Most responses were collected via Google form, and follow-ups were taken for those participants who were comfortable to giving their contact details and their personal email IDs. Our questionnaire has two parts. The first covered demographic details, age, gender, designation, etc., while the second measured three variables using a 5-point Likert scale. After that, these are some pictures which we have collected during our this research. Now this is pilot study reliability and valuability scheme. Pilot study was involved 38 employees in both medical and paramedical staff, about 10% of the total population in all, including respondents. So on the basis of responses given by respondents using Cronbach's alpha and SPSS, the reliability of scale used in study was assessed, and we can see the reliability of in all the cases are reliable. After that, we have done CVR, that is content validity ratio. Content validity ratio was first given by Loshi in 1975 and later explained by Adey and Skelly in 2014. And content validity ratio is simply a test used on scaled item to ensure that only the necessary and relevant items were retained for the study. To achieve this process, subject matters experts and industrial experts were consulted. Their opinions helped determine which items should be deleted or retained in our study. The experts are provided with a questionnaire where they categorized all items into three groups. Number first is essential, second useful but not essential, and not necessary. And the formula for calculating for CVR is NE minus N divided by 2 whole divided by N divided by 2, where N is the total number of experts who rated the item as essential and N is the total number of experts on panel. So the CVR values ranges from -1 to +1. A higher CVR value indicates that more experts agree on the item's essentiality. These are the expert details from both the academician as well as industrial experts. After the deep discussion with the experts, it was decided that not all the items were equally important in our study. So some of the items were deleted from our experts based on Loshi's CVR value. Only items which are score of 0.62 or higher were kept in our study, while the rest were removed. And also, experts have suggested changes in wordings like grammar mistakes, tenses which are incorporated, and the following table which shows the retained and deleted items. These are these items were deleted by our respected expert panels because the CVR value is less than 0.62. After that, these are the results and discussion. First of all, we have results on the basis of demographic characteristics. This study's reference sector hospital had higher percentage of female participants than male. Although our study's reference sector of hospitals have 55% female and 44% male participants. Most respondents have their undergraduate degrees, while the majority have their postgraduate degrees. Out of 382 employees who participated in the survey, 219 were married and 163 were unmarried. After that, let me start with the first objective. The first objective is to study the effect of human resource development climate on work-life balance in selected hospitals of Punjab. So, to accomplish this objective, I have used Smart PLS4. After that, for this objective, we have tested hypothesis. The hypothesis, there is a significant effect of human resource development climate on work-life balance. After that, we have used p values. After that we have used p values, and after that we have in order to find the results how independent variable, that is human resource development climate, effect on work life balance, that is dependent variable, it is about 0.567, that is approximately 56.7% impact on dependent variable. After that the result shows the p value is lower than 0.06. So this clearly indicates that our independent variable, that is human resource development climate, has a positive significant effect on work life balance as path coefficients are less than 0.05. After that, look at the previous studies. If we look at the previous studies, Khan-Wheeler in 2008 maintains and explores HRD's potential impact on work-life balance concern. He provides several theories as to why human resource development's position has been so concentrated. So the author then offers a few arguments in the support of human resource development being involved in work-life balance concern. He concluded by making some specific possible suggestions for the researchers and practitioners who might wish to think about concentrating some of their HRD work on work-life balance concerns. So previous researchers has concluded that human resource development climate has an effect on work-life balance. However, no empirical study has been conducted on these two variables. So our study is an effort to test these two variables empirically, and the results are in line with the predictions made by previous researchers about the potential effect of human resource development climate and work-life balance. This is the second objective of our study, to study the effect of human resource development climate on organization commitment in selected hospitals of Punjab. For this objective, we have also used smart PLS. After that, we have tested same hypothesis. The hypothesis, there is a significant effect of human resource development climate on organization commitment in selected hospitals of Punjab. After that, we have used p values. And also we have realized R square and R square adjacent, how much independent variable that is in this objective human resource development climate and effect of human resource development climate on organization commitment, that is about 73.1%.
इसी में कुछ पूछ सकती हूँ मैं आपसे, पाथ कोफिशिएंट क्या होता है? आपने यहाँ लिखा है पाथ कोफिशिएंट.
Yes ma'am, this is about the p values.
तो p वैल्यू लास्ट में लिखा है आपने 0.00 और ऊपर लिखा पाथ कोफिशिएंट.
Ma'am, this is full table which PLS has given us during our this analysis.
So what is the significance? दो लिखा हुआ है, एक ओरिजिनल सैंपल लिखा है, एक सैंपल मीन लिखा है, दोनों में वैल्यू सेम है. देखो आपके टेबल में लिखा है फर्स्ट वाला कॉलम है, उसके बाद सेकंड में लिखा है ओरिजिनल सैंपल, फिर लिखा है सैंपल मीन.
Ma'am, this path coefficient is for only for p values. We have considered only p values in this table.
वो तो बात बिल्कुल ठीक है, लेकिन दो वैल्यू सेम आई हैं, उसका क्या मीनिंग है? अगर सेम ही है तो एक ही होना चाहिए, अगर अलग है तो क्या सिग्निफिकेंस है?
Ma'am, we have considered only p values on the basis of significance.
So much that I understood.
ओरिजिनल सैंपल और इसमें बात कर रहे हैं मैम, दोनों में आपने 0.855 लिखा है ना?
Yes ma'am.
तो हो सकता है कैलकुलेशन सेम आई हो, पर दो क्यों है? अगर दो हैं तो उनका अलग मीनिंग होगा या एक ही चीज के दो नाम हैं?
Ma'am, actually sample mean is m is also, this is mean value 0.855.
That I understood what is the meaning of mean, but you have written two terms, original sample.
गलत है, ओरिजिनल सैंपल तो इसकी
Ma'am,
शॉर्ट होनी चाहिए थी ना?
She has to explain. बताओ बेटा.
Ma'am, actually when we started this PLS, the path coefficient table is given by the PS. I had not written this thing in my paper.
जो आप लिख रहे हो उसको तो आपको एनालिसिस करना था ना, अंडरस्टैंड करना है कि आपने टेबल प्रेजेंट किया है तो आपने इनकॉर्पोरेट किया है अपने थीसिस में, तो व्हाट इज द मीनिंग ऑफ दैट? ये है मेरे क्वेश्चन.
ऑन द सोर्सेज शी इज राइटिंग द ऑथर्स ओन कैलकुलेशन, तो जो ये कह रही वो भी नहीं कह सकते. उल्फत, आपने वहाँ पे लिखा है सोर्सेज में, पढ़ो क्या लिखा है.
Yes.
ऑथर्स ओन कैलकुलेशन.
Yes ma'am.
फिर उसके बाद आप कह रहे हो टेबल आपने नहीं बनाया, वैल्यू वहाँ से आ गई है.
No ma'am, actually data was mine.
नहीं, आप मैम का क्वेश्चन है पाथ कोफिशिएंट क्या बताता है? व्हाट इज द रेलेवेंस ऑफ दिस पाथ कोफिशिएंट? व्हाई यू हैव डन दिस पाथ कोफिशिएंट?
मैम,
बॉस आपको स्मार्ट पीएलएस बना के देगा, बट उसका इंटरप्रिटेशन तो आपको बताओगे ना, कि आपको तो बहुत कुछ बना के देगा, आपने उसमें से पिक एंड चूज किया ना कि ये मेरे को ये यूज करना है, तो पाथ कोफिशिएंट क्या रिफ्लेक्ट कर रहा है आपका?
ma'am, it gives the mean and standard deviation also, the p values also.
बट दी ओनली 0.855 जो आपने लिखा है ना, दोनों जगह सेम लिखा है, वो नहीं है, उसमें से गलत है वो एक. आप देखो ओरिजिनल सैंपल और दी है सैंपल मीन। सैंपल मीन आपका 0.855 हो सकता है, ओरिजिनल सैंपल अगर 0.855 है तो फिर ओरिजिनल मीन उतना नहीं होगा ना।
चलो नेक्स्ट आओ और इसको अंडरस्टैंड करो कि मैं क्या पूछना चाह रही हूँ। नेक्स्ट नेक्स्ट चलिए।
After the result shows the effect of human resource development climate on organization commitment that p-value is less than 0.05. So the result of hypothesis test demonstrated that human resource development climate has a considerable effect on employee organization commitment in the healthcare sector. So the hypothesis is accepted. After that, these are some relevant studies. Similar studies have conducted in different sectors has found a significant relationship between human resource development climate and organization commitment. And we have seen many these scholars have done their research on human resource development climate practices on organization commitment among employees in banking sector. Their finding revealed that human resource development initiatives such as training and career growth opportunities significantly enhance employees' organization commitment. The importance of this relation, which is revealed from our study, has been supported by earlier research, so which highlights that human resource development climate and organization commitment has positive impact on relationship between both these variables. After that, this is the third variable of our study to examine the mediating role of organization commitment and work-life balance in select hospitals of Punjab. For this, we have also used smart PLS, but additionally, rather than using PLS algorithm, we have used PLS bootstrapping for mediation analysis, and this is the model for the mediation analysis. After that, we have calculated many things. Firstly, path coefficient. After that, total indirect effect, specific indirect effect, and total effect. So we do mediation on the basis of VAF, that is variance accounted for. The formula for variance accounted for is indirect effect divided by total effect, that is about 65%. So our conclusion is that organization commitment can partially mediate between human resource development climate and organization work-life balance. So above table shows the mediation analysis. As we see the here et al. In 2013 states that there is no mediation if VAF is less than 0.20. Partial mediation occurs when if it is between 0.20 and 0.80, and full mediation if it is larger than 0.80. In our case, the organization commitment partially mediates, that is about 65%. So the hypothesis is accepted because organization commitment partially mediates the relationship between human resource development climate and work-life balance. After that, this is a discussion about the third hypothesis. Mayer and Allen in 1937 emphasized that organization commitment mediates the relationship between HR practices, including human resource development, climate, employee outcome, work-life balance, highlights the role of organization commitment in reducing work-life balance. Also,
अभी एक मिनट देखो, आपने 1997 से लिया, that is very good.
Yes, ma'am.
But 2023 के बाद अब तक 24 तक कोई और रिसर्च हुई नहीं जिसमें इस चीज को रेफर किया गया है।
yes,
अब बीच में आपने बिल्कुल ही गैप छोड़ दिया कि किसी और ने इस चीज के बारे में बात ही नहीं करी। एक वेरिएबल के बारे में बात करी होगी, दूसरे के बारे में बात करी होगी, और वो अलाइन है आपकी रिसर्च से। ऐसे लगता है कि 97 में हुआ, 2023 में कुछ हुआ, उसके बाद कुछ नहीं हुआ, और उसके बाद हमने कर दिया।
नहीं मैम, एक्चुअली मैंने प्रीवियसली बोल दिया कि जो मेरा फर्स्ट ऑब्जेक्टिव है उस पर ज़्यादा एम्पिरिकल स्टडीज नहीं हुई है।
बिल्कुल ठीक है, दूसरे में भी नहीं हुई है, इसमें भी नहीं हुई है।
नो मैम, एक्चुअली दिस इज मीडिएशन, दिस इज नो मैम, एक्चुअली मैम दिस इज मीडिएशन एनालिसिस।
हाँ तो कोई बात नहीं, कुछ तो किया होगा मीडिएशन में, किसी ने कुछ किया नहीं, बताया ही नहीं।
यस मैम, आई हैव रिटन इन माय PhD दिस थीसिस बट नॉट मेंशन्ड है। यस मैम, श्योर मैम, आई
हाँ पढ़े तो होंगे ना, पढ़े के बारे में भी बताना है आपने। हो सकता है ये चीज अलाइन ना हो उनसे, यू कैन हैव अ डिफरेंट पॉइंट ऑफ व्यू। हो सकता है जरूरी नहीं सबने पंजाब में किया हो, किसी और रीजन में भी किया हो सकता है, तो यू हैव टू मेंशन दैट आल्सो because in another I have done my research in this area.
Thank you.
Next.
After that, this is the fourth hypothesis. Work-life balance acts as a mediator between the human resource development climate and organization commitment. This is a structural model. After that, we have used path coefficient, total indirect effect, specific indirect effect, and total effect. After that, we have done mediation analysis. There is partial mediation also, that is about 36%. The conclusion is work-life balance acts as a partially mediator between human resource development climate and organization commitment. After that, this is the discussion. Abraham and Alfasi in 2014 highlights that in organization with a supportive human resource development climate, employees develop a stronger sense of commitment, which mediates the relationship with work-life balance by fostering loyalty and reducing work-related stress. Also, another study has done which have found that work-life balance partially mediates the relationship between human resource development climate and organization commitment in hospitality industry. So, in our study also revealed that work-life balance can mediate between human resource development climate and organization commitment. This is the last objective of our study. To study the comparative analysis of selected hospitals of Punjab based on private and public ownership. For this, we have used MGA, that is multi-group analysis. Multi-group analysis were used in both the private and public hospital adopted work-life balance, human resource development climate, and organization commitment. And we see this is the hypothesis testing for this. In all the cases, all the relations, the hypothesis testing is supported, that is less than 0.05. And also this MGA has given also this table which shows that all the path coefficients, difference and significance, all the exploratory variables are significantly different, as the p-value is less than 0.05 in all the cases. The beta value, that is minus 0.062, shows that human resource development is better in public sector as compared to private sector hospital, while the beta value for work-life balance and organization commitment are 0.088 and 0.045 respectively. Since human resource development climate is not up to mark in private hospitals, therefore it is suggested that they produce training programs to improve the same. This is the discussion. Khan et al. In 2021 in their study, which is conducted across South Asian countries, indicated that public hospitals have an effective human resource development climate due to standardized HR practices, HR training, strong leadership commitments, and emphasis on employee development, leading to higher organization commitment. Also, Chaudhary and Verma in 2017 found that private hospitals offer better work-life balance through flexible working schedules, supportive management, and employee-centric policies, leading to enhanced organization commitment among healthcare professionals.
ये आपने उल्टा क्यों किया है? 2021 पहले आया और 2017 बाद में क्यों आया?
डिस्कशन ऑब्जेक्टिव वाइज किया क्या?
नहीं, वो तो ऑब्जेक्टिव वाइज कर रही है, वो तो ठीक है, दैट्स ओके।
इन द सेम ऑब्जेक्टिव शी इज डिस्कसिंग।
हाँ, तो फिर ये आपने ये पहले उसको क्यों दिया, इस वाले को बाद में क्यों, जब हम हमारा ऑब्जेक्टिव सेम ही है? पहले हम क्रोनोलॉजिकल ऑर्डर में चलते हैं, पहले पुरानों को डिस्कस करते हैं, क्योंकि बाकी सारे ऑब्जेक्टिव में ऐसे ही किया है आपने।
यस मैम।
तो इसमें ऐसा क्या खास था?
No ma'am, nothing. Actually ma'am, this is about the work-life balance is acting as a mediator and
यही है हमारा ऑब्जेक्टिव, तो यही है, इसी ऑब्जेक्टिव के ये दोनों रेफरेंस आपने लिए हैं।
yes,
तो ये पहले पुराना ले रहे हैं, फिर उसके बाद नया, यही आप मेथड कर रहे हैं बाकी सारों का। इसमें कुछ खास था क्या, ये आपने उल्टा कर दिया उसको, प्रोसेस को?
no ma'am.
ऐसे ही मर्जी है, जब मन करा ऐसा, जब मन करा ऐसा। देयर शुड बी सम लॉजिक बिहाइंड दैट।
ओके मैम।
वो पहले वाला मेथोडोलॉजी ठीक है, आप वही प्रोसेस से चलते हैं।
यस मैम।
चलिए ध्यान रखिए इस चीज को।
ओके मैम।
तो ये डिस्कशन आप अपनी रिसर्च के एनालिसिस की इंटरप्रिटेशन के बाद कर रहे हैं।
मैम प्रीवियस, यस दिस इज प्रीवियस रिसर्च।
प्रीवियस वाली आप पुरानी स्लाइड पे जाओ, ये आपका इंटरप्रिटेशन है, करेक्ट? अब इसके बाद आप जो डिस्कशन कर रहे हो लेमन लैंग्वेज में, व्हाट वी शुड इंटरप्रेट फ्रॉम योर एनालिसिस।
Ma'am, no, these are some studies which are aligned with our study results.
Correct.
Yes, ma'am.
Now, where is the alignment of your into the discussion?
Ma'am, I told in this previous slide, the beta value is less than 0.062.
नहीं, आप समझो बिल्कुल। ये आपका इंटरप्रिटेशन है।
Yes, ma'am.
ये डिस्कशन नहीं है।
Yes, ma'am.
है ना? इंटरप्रिटेशन है रिजल्ट का।
Ma'am, I also include this interpretation. In interpretation also I have included my study, what I have done in my study.
हाँ, but you are talking that what values are saying to you.
Yes, ma'am.
So this is interpretation.
Yes, ma'am.
Right? You have done the data analysis. This is interpretation.
Yes, ma'am.
Next slide is your discussion. But this discussion is what previous researchers have done.
Yes, ma'am.
Now they need to be aligned with what your interpretation and discussion should be.
Yes, ma'am.
That is missing.
As I need to understand. Suppose I am referring your study for the first time,
Yes.
and I am a new researcher. I cannot understand beta values and all that. and I want to use your because my research is aligned with your topic.
Yes, ma'am.
So what I do, I look at your layman discussion.
Yes, ma'am.
Which you are saying it over here into the next slide.
Yes.
So there has to be something which is your interpretation, your
contribution
Yes,
to
ma'am.
the research.
Objective wise. What you have very good said about what others have done.
Yes, ma'am.
But what is your, which I can use, need to be there in the discussion. Then I think this is not required what you are saying for the other researchers.
Ma'am, I also mentioned here after these beta values, which clearly shows that two aspects of human resource development management are better in private sector. Private sector as compared to public sector.
No, absolutely right. I am not saying that you have done an incorrect research.
Okay.
My point is, I like your research and I want to use it the next for my researchers. But my researchers in the initial stage cannot understand your beta values and everything. So your discussion should be there in layman language also.
Okay, ma'am.
That is what I'm trying to say. Right?
Yes, ma'am. Yes, ma'am.
Next.
After that, these are some theoretical implications. A strong human resource development climate with the focus of work-life balance contributes to higher employee engagement and productivity by creating an environment where healthcare workers feel valued and empowered. And the human resource development climate strategies also implemented within healthcare sector organizations. They can shape the overall culture, foster collaboration. They can also cooperate and positive interaction among staff, which enhance organization effectiveness. Also, the theoretical relationship between human resource development climate and improved patient care outcomes underscored by linked between health, staff well-being, organization commitment, and quality of service delivered. After that, these are some practical these implications. Healthcare organization with strong human resource development climate can ensure high level of staff morale, leading to improved patient care and satisfaction, and engaged staff are more likely to deliver better patient care. Also, organization with a positive human resource development climate are better equipped to handle industry change, manage challenges, and implement necessary adjustment effectively, resulting in cost saving and smoother operations. After that, these are recommendations. Healthcare sector can conduct regular training sessions and workshops focused on professional and personal development of medical and paramedical staff to enhance their clinical and non-clinical skills. They can also promote a culture of continuous learning by providing access to medical seminars like online healthcare courses, certification and skill enhancement programs relevant to the healthcare sector. They can also introduce flexible working schedules or shift rotations to help healthcare workers to manage their professional and personal life, especially for those who are in high stress roles. After that, they can invest in modern medical technologies and digital tools to improve patient care and reduce the administrative workload on healthcare workers. Also, they can involve healthcare professionals in decision-making process, especially regarding patient care policies and hospital management to increase their engagement and commitment. Also, they can implement leadership development programs to create supportive healthcare leaders who foster a positive and motivating work environment for doctors, nurses, and paramedical staff. After that, in a nutshell, we have seen this model in the form of how human resource development climate impact on work-life balance and organization commitment, and also which benefits they are giving in both organization and employees. They include enhanced employee performance, benefits for organization, increase engagement, and it will also improve organization culture. For the benefit of employees, it included improved patient care, reduced burnover, and enhancement job satisfaction, increased retention, also better collaboration and communication, and all these things. These are some limitations of our study. We have collected data for busy scheduled doctors that were very challenging due to their hectic schedule and busy working hours. So continuous follow-ups and reminders were needed to ensure their responses highlighted the necessity of proactive measures. Also, our study has three variables: human resource development climate, organization commitment, and work-life balance in hospitals. During initial phase validity, we have many challenges arose in contacting hospital management specialists for validation. These experts specializing in hospital human resource evaluate different sections of the questionnaire. So the findings of the study based on data for Punjab And our future scope is we have used only Public Health System Corporation and National Accreditation Board of Hospitals in the state of Punjab. So for the more relevant and results, new researchers maybe in future consider public and community healthcare sectors. In future, a new direction may be invested by considering comparative analysis. We have done public as well as private, but researchers may do among female and male healthcare professionals as well as comparative study among medical and paramedical staff. These are our references. These are some publications which we have got during our research. These are a list of international conferences, and these are some workshops which we have attended during our presentation.
You have attended.
Sorry,
You have attended. Okay. Okay, so that's wonderful.
Thank you.
Very good. You have tried to justify your topic.
Yes, ma'am.
Try to explain what you have worked, and you have done a hard work for this. So work is commendable, but the protocol is I have to ask you questions
Yes, ma'am.
which the examiner has raised.
Yes, ma'am.
So I'll ask a couple of questions. Few questions you have answered previously.
Yes, ma'am.
The first question is asked us, what is the motivation that you have taken this research problem?
Ma'am, actually, for the medical and paramedical staff, their work-life balance is very bad. They can't do their, they have no balance between their personal and professional.
Work-life balance may be bad to any other sector also.
Yes, ma'am.
So why you have chosen this?
Ma'am, because for healthcare employees, it is more challenging in case of apart from education and other sector.
Okay. Then the second part of this, when you have chosen this health sector, why Punjab?
Ma'am, I also told why I have chosen this geographical area, because we have seen that in Punjab, the Jalandhar is known as a medical care hub, due to its more than 800 multi-specialty hospitals and nursing homes. Also, we have seen I have seen that many patients come from other countries and other states come from here for affordable health and affordable these medical facilities.
So what is the population of Punjab?
Ma'am,
How long you are living here in Punjab?
ma'am, I am from 2021. I am here.
Okay.
Yes, ma'am.
So do you have some idea of what is the population of Punjab?
Ma'am, no, total population is not exactly.
Estimation?
Yeah, ma'am, actually I have these taken this on the list of 3 regions, that is Maja, Doaba and Malwa.
They are in the Punjab.
Yes.
What is the population of that region?
Ma'am, it is approximately for this private healthcare sector, it is 6,823, and for public hospital, it was 3,127.
My question is different.
Yes, ma'am.
Total population
Not-
is asking.
Okay, not in healthcare sector.
Overall population.
Population of those
मैम है ना
state, not the hospital in those
Okay,
regions.
okay.
अपने साइंस से जानते थे
ध्यान से,
जो
ध्यान से।
जनरल नॉलेज
बराबर।
बट आज के बच्चों में नहीं जानना नहीं चाहते
स्टडी को तुम्हारे से ज्यादा कोई अच्छा नहीं बता पाएगा, मैम जानना चाह रहे हैं बस।
Yes, yes. Ma'am, no, I thought ma'am is asking about the time.
रिलैक्स होके
Okay.
नहीं बिल्कुल आराम से आप क्वेश्चन क्लियर है ना कि आप इस पंजाब योर रिसर्च वर्क आपने उसको कैसे आइडेंटिफाई किया, कैसे जस्टिफाई कर रहे हो? यू हैव डन इट योर वर्क,
Yes, ma'am.
सो उसको कैसे जस्टिफाई कर रहे हो ये बताइए. अकॉर्डिंग टू पॉपुलेशन यू सेड कि बहुत स्कोप है, वर्क लाइफ बैलेंस नहीं है, अकॉर्डिंग टू यू एज यू मेंशन्ड इन योर वर्क. सो पॉपुलेशन वाइज इसको कैसे आप जस्टिफाई करते हैं? आपने पंजाब चूज किया बिकॉज यू से नीड इज ओवर हियर, सो आई वांट टू स्टडी दिस.
Yes, ma'am.
तो ये वर्क लाइफ बैलेंस किसका है? पॉपुलेशन लोगों का ही तो है ना, तो कितने लोग हैं?
मैम इट इज़ नॉट ये लोगों का नहीं, मैंने मतलब पैरामेडिकल और मेडिकल स्टाफ को लिया है।
तो लोग इसमें वो स्टूडेंट कोई तो है, ह्यूमन बीइंग तो है
yes, ma'am.
जो वहाँ रह रहे हैं, जो वहाँ की पॉपुलेशन को कैटर कर रहे हैं, या आपके बाहर से लोग आ रहे हैं उनको कैटर कर रहे हैं।
Yes,
तो किस प्रपोर्शन में हैं वो लोग, यही जानना चाह रहे हैं। 2% है, 1% है, 5% है।
यस मैम।
मतलब वहाँ तक कैसे पहुँच रहे हैं?
हाँ
वहाँ तक कैसे पहुँच रहे हैं?
मैम अकॉर्डिंग टू PHC नॉर्म्स आई हैव।
मेरा क्वेश्चन क्लियर करो, क्या मैं पूछना चाह रही हूँ, आप इसको अपने वर्ड्स में।
आप मैं तो
ओवरऑल पॉपुलेशन कितना है पंजाब का?
मैम इन जनरल
पॉपुलेशन तो पॉपुलेशन होता है, जनरल नॉन जनरल से तो मतलब ही नहीं है।
हॉस्पिटल के एम्प्लॉइज के कंटेक्स्ट में मैम नहीं
कि पंजाबी क्यों लिया ना हमने? व्हाई वी हैव सिलेक्टेड पंजाब?
हम सब उसके पास नहीं है, इसके क्वेश्चन भी नहीं समझ पा रही ना उसने। शी हैज नॉट थॉट ऑफ दैट पर्सपेक्टिव व्हिच वी आर टॉकिंग ऑफ, जबकि हर रिसर्च स्कॉलर में ये होना चाहिए, हमारी डिस्कशन में भी ये चीज़ आनी चाहिए। देखो मैम बस जानना चाह रहे हैं कि टोटल पॉपुलेशन अगर आपको नहीं पता, इन्होंने बहुत अच्छा एग्जांपल दिया है कि इस रूम में अगर हम 1000 लोगों को खड़ा कर दें तो क्या पॉसिबिलिटी बनती है। अगर मान लीजिए हमें रूम की साइज पता है और 1000 लोगों को, हम सबसे पहले ये कहेंगे ना कि इस रूम में नहीं आ सकते। तो वैसे जब आप अपने हेल्थ प्रोफेशनल्स को चूज कर रहे हो तीनों रीजन से, तो आपको ओवरऑल पॉपुलेशन तो पता होना चाहिए ना।
मैम आई एम नॉट
हॉस्पिटल्स ऑफ पंजाब को लिए।
यस मैम।
क्यों लिए?
population size
3127 mentioned है तो
yes ma'am, that is I told already, that is in public sector. Population of public sector is 3127, and in any beach hospital that include private hospital, that is about 6828. I have mentioned in, and also I told,
सब डिस्ट्रिक्ट का टेबल बना के कर
yes ma'am, I have already shown in the table.
ठीक है, ओके। सेकंड पॉइंट ये पूछा है कि रिसर्च गैप्स क्या थे। ऑलरेडी रिसर्च में आपने बता दिया मेरे को, बहुत सारी रिसर्च हुई है।
Yes, ma'am.
आपकी रिसर्च यूनिक है ना? यूनिक आपने बोला आपकी रिसर्च यूनिक है?
नहीं मैम, यूनिक नहीं बोला,
हाँ।
प्रीवियसली स्टडी हो गई है,
हाँ।
बट इन केस ऑफ आई हैव सीन इन पंजाब सेक्टर मोस्टली द रिसर्च हैव डन इन केस ऑफ दिस nurses sector only, but I have chosen medical and paramedical staff, both doctors as well as nurses and OT technicians, all that.
तो ये यूनिकनेस है आपकी रिसर्च की।
Yes ma'am.
यही तो मैं पूछ रही हूँ, व्हाट इज द यूनिकनेस ऑफ योर रिसर्च
Yes, ma'am.
दैट यू हैव टेकन पैरामेडिकल स्टाफ व्हिच
And-
द अदर पीपल हैव नॉट टेकन।
Yes, ma'am.
ठीक है, अब जो भी रिसर्च करेगा, प्रियंका मैम को अगर रिसर्च करनी होगी तो आपकी रिसर्च रेफर करेंगी फॉर द पैरामेडिकल स्टाफ। ठीक है, यही बात है कि मैम मेरे को रिसर्च करनी होगी तो आपकी रिसर्च जो होगी वो टॉप सर्च पे आएगी कि आपने वो काम किया। यही है या नहीं?
Yes ma'am.
यही मतलब होता है?
जी मैम।
ठीक है, अब और क्या पॉसिबिलिटी है और क्या चीज आप मिस कर रहे हो इसमें, जो मैं आप रिसर्च करूं तो वो चीज, क्योंकि आप तो यहाँ तक पहुंच गए हो।
Yes, ma'am.
आपको ये पता है कि मेरी लिमिटेशन थी टाइम की, मैंने इतना ही किया, इसके आगे पॉसिबिलिटी क्या है आपकी एक स्लाइड की फ्यूचर ग्रोथ की।
Yes, ma'am. Ma'am, actually, we have done. I have done research on these. I have included Public Health System Corporation and this National Accreditation Board of Hospitals. New researchers can continue with community hospitals also. They can choose also these community hospitals and these dispensaries also, which we have not mentioned in our study.
अच्छा, तो उसमें हम क्या कंट्रीब्यूट कर पाएंगे? अब वो वही चीजें आएंगी जो आपने किए हैं, या उनको इंक्लूड करने से कुछ और एनहांस होगा?
मैम एनहेंस उनका जो टोटल पॉपुलेशन है वो एनहेंस होगा, एंड डेटा दिस सैम्पल साइज विल बी आल्सो डिफरेंट।
मैं सैंपल साइज से पूछना चाह रही थी, लेकिन आपको पॉपुलेशन ही नहीं पता, तो मैं सैंपल साइज का क्वेश्चन नहीं फ्रेम कर पा रही हूँ कि आप उसको आंसर कर पाओगे। मेरा ये क्वेश्चन था कि आपने ये सैंपल साइज जो 328 है ना?
यस मैम।
तो वो 328 आपको लगा कम नहीं है? ज्यादा नहीं होना चाहिए?
Ma'am, when I this analyzed this sector, both the sectors, population of both sectors, that is private and public, then I total both the sectors, that the population made 9,951. After that, I have used Riemann's formula for this calculation. Then I put the values in that formula, and I got my sample size, that is 380.
वो मैंने फॉर्मूला देख लिया. आप बताइए सैंपल और पॉपुलेशन में डिफरेंस क्या है? अगर हम सभी लोगों से पूछ लेते तो हमको ज्यादा अच्छा रिजल्ट मिलता. तो क्या पॉसिबल नहीं था कि सभी लोगों से पूछा जाता कि आपकी क्या इश्यूज हैं, आपके जो गैप्स हमने आइडेंटिफाई किए हैं इसमें, उनको अच्छे से हम कंट्रीब्यूट करते हैं लिटरेचर में.
मैम एक्चुअली यस, वो भी हो सकता है. जैसे मैंने यूज़ किए हैं ओनली दिस PHSC नॉर्म्स के अंडर जो हॉस्पिटल्स आते हैं, जो भी बाकी हॉस्पिटल मैंने उनको छोड़ा है, और जो नेशनल एक्रेडिटेशन बोर्ड है जिनको एक्रेडिटेशन मिली है हॉस्पिटल्स को, मैंने वो सैम्पल साइज के लिए लिए हैं.
नहीं, देखो मिक्स मेथड अप्रोच मैम कहना चाह रहे हैं. अगर तुम मिक्स मेथड अप्रोच लगाती तो you can get better results, because you will ask also the people what I am using as the parameters. Is it
Yes, ma'am.
actually the parameters to test your work-life balance?
Yes, ma'am.
And further, it's
So
not
mixed
only
method approach
research.
I think should be used.
You have taken publication, focus on publication, and then also you discuss with the hospital and their expert.
Yes, ma'am. That will be the improvements in their sectors.
But mixed method approach भी use है ना?
No, ma'am.
वो तो एक और एग्जामिनर ने भी लिखा है कि मिक्स मेथड अप्रोच ही यूज करना चाहिए था. व्हाई यू हैव नॉट यूज्ड दैट? तो उसका क्या आंसर है? मिक्स मेथड क्यों यूज किया? यही आता था मुझे, यही आता था कि यही कर लिया.
ये लिमिटेशन
Yes, ma'am.
नहीं, कोई बात नहीं, हर चीज हर काम नहीं कर सकते. यू हैव टू जस्टिफाई दैट. ऐसा कुछ नहीं है कि यूनिवर्स में हर बंदा हर चीज कर ले. रिसर्च का मतलब एक टाइम स्पैन में आपने किया है, तो यू हैव टू मेंशन इट कि विद इन दिस टाइम स्पैन आई कैन डू, और आई वाज नॉट अवेयर. आपने एक जगह BLS यूज किया है, क्या यूज किया?
Yes, ma'am. Smart
PLS.
Yes, ma'am.
क्या होता है स्मार्ट PLS?
Ma'am, it's a software.
ओके, क्या करता है ये?
Ma'am, we will give the data, and it will give the model for our this objective, in which it shows that this how much independent variable and dependent variable are this variability is there in the model.
वेरिएबिलिटी बताता है या फैक्टर एनालिसिस करता है?
No, ma'am. Factor analysis MOS में हम यूज करते हैं. Yes, ma'am. But in this case ये directly variability देता है, how much independent variability is present in towards dependent variable.
तो SPSS में और अगर हम इसमें करते हैं तो फर्क क्या है?
मैम फ़र्क तो लेटेस्ट हमारा जो अब इस टाइम में चल रहा है वो स्मार्ट PLC चल रहा है, बिकॉज प्रीवियस स्टडीज हैव डन थ्रू दिस SPSS, बट दिस वाज लेटेस्ट एट माय टाइम आई यूज्ड दिस.
पर दोनों सेम ही करते हैं.
आपने कौन सा स्मार्ट PLS यूज किया?
मैम स्मार्ट PLS 4. यस मैम.
ठीक है, दैट्स गुड.
थैंक यू.
So that's all from my side. Congratulations to you.
Thank you.
And congratulations to you. Open for the others to ask the questions.
Ma'am, you've already asked my question. She has not liked the answer actually. जब मैम ने पूछा था ना आपसे कि आप बाकी में क्यों नहीं कर रहे हो सेक्टर्स में, तो आपका आंसर आती था कि क्रॉस सेक्शनल स्टडी मैंने नहीं करी.
हाँ, वही तो.
शुड भी है ना, तो वो आंसर नहीं आ रहा था एक्चुअली. तो क्वेश्चन तो मैम ने तक पूछ लिया, मिक्स मेथड की, क्रॉस सेक्शनल की. दैट वाज एक्चुअली माय क्वेश्चन आल्सो फ्रॉम योर साइड.
थैंक
आप जो फॉर्मूला यूज करते हो ना, जब इनफाइनाइट आपका सैंपल होता है तो आप फॉर्मूला यूज करते हो.
यस मैम.
तो वही मैम पॉपुलेशन और वो पूछ रहे हैं सैंपल आपसे, अगर ये आपको आंसर ये पता होता है ना, ये एक्चुअली ना गाइड बता देते हैं, ये डिस्कस समझते नहीं है, जो कह दिया गया उसको बस सुन लेते हैं. जब ये इनफाइनाइट पॉपुलेशन होगी, अब आप अगर अपने ये करना चाहो तो क्या आपके लिए पॉसिबल है? अगर मान लीजिए पंजाब का डेटा आपका टोटल पॉपुलेशन जो है वो पुराना है, 2000 का है, आप स्टडी तो 2025 में कर रहे हो, तो क्या आप कैलकुलेट कर सकते हो पूरी पंजाब की पॉपुलेशन की कितनी है?
यही तो मैं इससे पूछना चाह रही थी, ये जवाब ही नहीं दे पा रही थी. यही मेरा सवाल था.
अभी भी बता दो हाँ या नहीं, कर सकते हो आप?
मैम जो हमारे नेशनल एक्रेडिटेशन बोर्ड ऑफ हॉस्पिटल्स हैं, दे हैव मेंशन्ड.
अभी पॉपुलेशन इन जनरल पॉपुलेशन की बात करो, अभी हम मेडिकल प्रोफेशनल पे नहीं पहुंचे हैं.
यस मैम. हाँ मैम, कर भी सकते हैं.
Oh my God.
हम क्वेश्चन समझ में, आप इतना घबरा रहे हो?
मुझे तो आप ये टीचिंग में चले गए, थोड़ा सा ऊपर में आप चेंज।
टीचिंग में तो ये सारी चीजें ज्यादा अच्छे से पता होनी चाहिए।
आप वही कह रहे हैं कि शायद चेंज हुआ था,
अभी कितने मंथ्स हो गए ज्वाइन करे टीचिंग में?
मैम ओनली 3 months।
3 months।
यस मैम।
ऐसे क्वेश्चन स्टूडेंट्स के भी आएंगे आपके पास।
और ये जो आपने देखा है आपके उसमें, ये आपके पास रिपोर्ट थी ना?
यस मैम।
उन्होंने हर चैप्टर में लिखा है कि आप इंट्रोडक्टरी पैराग्राफ और जो है कंक्लूडिंग पैराग्राफ नहीं लिख रहे हो, और अभी भी नहीं लिखा अपने थीसिस में।
मैम आई हैव इंक्लूडेड
इंट्रोडक्टरी पैराग्राफ दिखा दो मुझे किसी भी चैप्टर में। ये आपकी इसके बाद सबमिटेड है ना?
यस मैम।
यू हैव अंडरस्टूड दैट इंक्लूड द इंट्रोडक्टरी पैराग्राफ का क्या मतलब है? नॉट द इंट्रोडक्शन अबाउट द वेरिएबल।
नो मैम, जब हम चैप्टर स्टार्ट करते हैं तो उसका इंट्रोडक्शन देना।
इस चैप्टर में हम क्या क्या लिखने जा रहे हैं दिखाना, इसमें तो कहीं भी नहीं है, एक भी चैप्टर में नहीं है।